Okay, so we're going to do a few fascial maneuvers. We're going to start off with twisty wristy. So take your right hand, start by getting nice and comfortable, neutral position, feet hip width apart, knees bent, and you're bringing your awareness up through the body, bringing in that pelvic spinal lock, head moving up into the ceiling. Take your right hand and you're going to get hold of the fingers and you're going to be pulling them back. This can be an uncomfortable position to hold, but it's really worth it. So just take a nice few deep breaths. Bring that arm up. Bring it down so that the elbow is tucked in against the ribs. You want to lock that in place and then turn the hand out like you're holding a serving plate. Take a nice deep breath. You're going to move the head and turn it over the left shoulder and rotate the torso to the right. Breathing in and out through the mouth. You can bend down, dip down a little, squat. Continue to breathe through the mouth. You can move around a little bit. Moving into those lines of tension. And coming up, coming out of the pose, shaking that off. Woo, hand's gonna feel pretty weird. If you notice your fingers now, there's a lot of redness, blood is rushing, moving through the hand, and you're opening up all that the lines of energy from the organs, the meridians, and you're gonna feel it all the way up the arm. You can feel this coolness moving through this side. Just notice the difference. Woo. And then we're gonna do the other side. So coming into that neutral position, feet facing forward, hip width apart, slight bend in the knees, bringing in the pelvic spinal lock, head moving up, top of the center of the head moving up to the sky. Taking the left hand, and again, we're going to be pulling the fingers back. It's going to be a little bit uncomfortable. You're having this kind of hold, then breathing, starting to focus on the breath, breathing in and out through the mouth. Breathing up, bringing it down, bringing the elbow right in, tucking it in against the ribs, and turning the hand out. You've got this whole side locked in place, and you're going to turn your head over to the right, looking over the right shoulder. Start to breathe in and out through the mouth 6 times. You can start to squat. Now in through the nose, out through the mouth, moving around. Moving into any lines of tension that feel good. And then coming out of the pose, shaking that off. You're gonna feel feel the strangeness in your hands. Start to notice that blood flow, that energy moving through the hands, the fingers up through the arms, moving up through the shoulder. You can feel your chest expanding. Ooh, shake that off. This is such a great practice for getting that energy into the fingers. Okay, and we're going to do another one. We're going to do the wrist release. So get into your nice neutral position, feet facing forward, knees slightly bent. You're bringing the pelvic floor up and the spine in, getting hold of the right hand, holding it palm up, and then getting the other hand, putting it underneath. And the thumb and the fingers clasp around the wrist. Hope you can see that. And then you are twisting externally, rotating externally, and rotating the hand internally. So you've got this rotation going on. Then you're going to be pushing through as if you're putting on a glove and also pulling the shoulder up. So you've got 4 levels of energy, of effort. You've got this rotation and you've got this pulling and pushing. So start to breathe now. You can lean into a chair to help push, keep the rotation. In and out through the mouth. In through the nose, out through the mouth. Start to move the hand into any of those lines of tension. Keep the rotation. And then you can move the arm around a little bit. Letting that go. Woo. And as you work on this part of the arm, you're also affecting the lower part of the leg, the ankle, because the zones are connected. Take that out a little bit, and then we'll do the other side. Okay, so coming back into your neutral position, pulling up on the pelvic floor, navel in, taking your left hand, palm facing up and underneath, curling your wrist and fingers over the wrist, and you rotate externally as you rotate the hand internally. So you've got this rotation going on, and you're going to be pushing as if you're putting on a glove and pulling the shoulder up. So you've got this 4 levels of direction going on, and you can rest on your knee so you can push more and start to breathe in through the nose, out through the mouth. And in and out through the mouth. Start to move the hand, the fingers. Feel into the lines of tension. And just move around and squat. Keeping the grip and the lines of tension. And then coming out. Ooh, that releases a lot of energy. You see all the blood flow coming into the wrist there, releasing the adhesions that happen in the forearm. Ooh, I can feel the energy moving up through the arms. That feels great. And we're going to do another one for the shoulders. We're sort of moving forward and moving up. This is the elbow talk. So coming to neutral, feet facing forward, hip width apart, up and in, pelvic spinal lock. Take the right hand and place the back of the hand up against the neck. So you've got a rotation already. Then you're going to take the left hand and grab the skin on the elbow, and you're going to rotate it externally. So you've got this twist going on. Now you want to make sure you've got a good hold of the skin on the elbow, because we're going to move a little bit and you want to maintain this grip. So you can start to breathe in through the nose and out through the mouth. And then cross the elbow. Look over the shoulder first, then cross the elbow across the body. Feel more of the rotation. You can feel the shoulder blade opening. Feel how it moves down to the body. Breathing in and out through the mouth. 3 more breaths. And now while we have the arm here, make an L shape and kind of grip under the clavicle and keep the rotation on the elbow, keep that grip and move the elbow up over the head. Now you're looking under the armpit to the right, start to breathe in and out through the mouth, leaning to the left. You can feel those lines of tension moving down to the side body. You can bend the right knee. You're going to feel that all down the side body, the shoulder. You're going to feel it going up into the neck and the head, the chest. Really great for shoulder mobility, any issues in the shoulder. Just give that a little bit more rotation and just sort of feel the difference as you walk about between the two sides. Yeah, this just feels like just open, just lighter, freer. Yeah, I'm gonna do the other side now. So coming into that neutral position, feet facing forward, hip width apart, bringing the pelvic floor up and the spine in, and getting hold of the left hand, putting the back of the hand up against the neck. So you've got the rotation started, and you get hold of the skin on the elbow and you twist it externally. You want to hold this grip and move your head over the shoulder, looking over the left shoulder. Start breathing in through the nose and out through the mouth. And then in through the mouth, out through the mouth, and move the elbow across the body and keep the rotation. Keep the lock. You may notice the back of the shoulder blade opening. Even energy moving all the way down to the knees. So coming up out a little bit, just take the hand in the L shape, pulling the skin at the clavicle, pulling the shoulder up. Keep the grip on the elbow. Move it up overhead. And then you're looking to the left, under the armpit, breathing in and out through the mouth. Moving your body to the right. Maybe bending that left knee. Feeling the stretch through the side body. Hip, knees. Really great opening. Shoulders. Feel the lightness. Start to walk around and let that integrate a little bit. Feeling really good. Feeling really open now in the shoulders and the back. Oh, and the torso. Okay, so another one we're going to do is a beautiful one for digestive issues, whether you have digestive dysfunctions of any kind, bloating, constipation, autoimmune. This is going to help open up that area of the hip also, and it releases the trapped emotions of fear, guilt, and shame that can be stuck in the body. So we're going to be doing a psoas release. So come back into a nice neutral position. You're going to be pulling up on the pelvic floor, navel in. You're going to put your left hand in your belly button and the right thumb on your hip. And where they meet on that side of the body is the ileocecal valve, which often gets either closed or open and locked in place and causes a lot of trouble for you digestively. So you're going to dig into this area and pull up. And it's going to feel like you are really ripping through the skin. It might feel like a burning sensation. Start to breathe in through the nose and out through the mouth. Let the shoulders drop. And you're going to take the right leg and you're going to put it behind you and come down, bending the left knee and pulling your body back, breathing in and out through the mouth now. Nice and deep. lean into the squat. You can twist the body a little. You'll feel it all the way down the leg, the hip. And then you can come out. That's releasing all the muscles around the fascia, around the psoas, and that goes into the digestive system and the core, all the fascia that's wrapped around there. So you really will feel an opening and start to shift into better digestive health. So we'll do the other side. I like to put the thumb in the navel and the left thumb on the left hip where the fingers meet. Nice, easy place. You're going on the other side. You're going into the small intestine and large intestine, the Houston valve on this side. So you're going to dig in again, breathing in and out in through the nose, out through the mouth. And you're going to pull up. You might feel like it's sort of ripping, tearing the skin, a burning sensation. That's good. Then you're going to step the left foot behind you. You're going to lean back, kind of squat down a little bit more and breathe in and out through the mouth. Head moves back. You dip down and you can move around. That's a wonderful one. Come out, move around a little bit, feel the sensations shifting in the body. You might even have some emotional release for this. And if you find it's difficult to move back and to balance, you can always come down onto your knee to do the position to make it a little bit easier. Put a cushion under your knee, kind of lean back, can be helpful. We're going to move into another digestive assisting maneuver. This is the belly button talk. There's a few different ways that you can do this. I normally like to do a more evolved, long kind of process for this because it's kind of a beautiful opening for the digestive system. It's helping the digestive system to unwind. It's all wound up and it can sort of bring the front body in a lot, especially when you're sitting, everything starts to get compacted and pushed together. So this is going to help to unwind the navel area, that whole center, which is going to give the digestive system a bit of a rest. There's also a lot of energetics here and emotions stored here. So this is great to release. And normally it's really good to do it for like 3 minutes, but we're just going to connect to it and do it in a little bit shorter. So if you want to put your right hand into the belly button itself, make sure that you don't have long nails. You'll have to put fabric around your fingers so that you don't damage the skin. But you're going to go into the navel. You're going to come into neutral position, pulling up on the pelvic floor, and you're going to be pressing in, really pushing in about 80%. And it's going to feel kind of uncomfortable. You're going to feel a lot of tension. You may feel the blood vessel pulsing. And you want to make sure you're twisting the fascia so the thumb goes up. So just breathing in through the nose, out through the mouth. I like to help and go deeper with the other hand. And now in and out through the mouth. It can be quite hard to maintain the grip when you move around, but if you feel like you've got it, you can also move a little bit.